Greetings to all speakers and participants. Welcome to our session. I'm Thea Hutanamon, Partnership and Development Manager of Stop TB Partnership Indonesia. I will be chairing the session about empowering TB control partnership in Indonesia, multisectoral accountability framework. We have a terrific line of speakers with us today who are representing multi-stakeholders engaged in the efforts to end TB in Indonesia. Our first speaker is Ferdiana Yunita, a senior TB control multi-sector partnership advisor from USA TB Star, with an extensive experience in public health and as a researcher and lecturer in the University of National Development. She will share with us about the Pentahelix Partnership Forum and its action plan for integrated TB response. On to the second speaker, we will have Nani Rohani. She's the head of the Infectious Disease Subdirectorate of the Coordinating Ministry for Human Development and Cultural Affairs of the Republic of Indonesia. With over a decade in her service for the public administration, she will illuminate us on the roles of government, communities, and other TB stakeholders in advancing the presidential decree on TB. We will then move on to the third speaker, Hani Ahmad. She is the National Program Director of the Community Consortium Penabulu STPI as the principal recipient of the Global Fund TB program for communities. She will address how communities plays a role in active case finding and case holding to support TB elimination. Our fourth speaker is Ruli Octavian, the head of Yahintara, that was established to offer alternative solutions to improve the quality of human habitat and built environment to better one life. He will share about the role of architecture for housing of people affected by TB and how this can address vulnerability to this disease. Our fifth speaker is Henry Diatmo. He's the Executive Director of Stop TB Partnership Indonesia, and he was a trained physician who became a public health advocate in the efforts to end TB. He will share about how behavior change campaign strategy gives leverage in accelerating TB elimination efforts. The sixth speaker is Yeni Purnamasari. She's the General Manager of Dompet Duafa Health Division, and she has been leading in advancing community empowerment through economic, psychosocial, spiritual, and vocational support for persons affected by TB. Lastly, our last speaker will be Ivan Pradipta. He's a faculty member in the Department of Pharmacology and Clinical Pharmacy in University of Pajajaran. He brings his expertise in clinical pharmacy and pharmacoepidemiology in the Indonesian Tuberculosis Research Network, or JETSAT-TB. He will share the role of the research network in supporting multi-sector partnership for tuberculosis in Indonesia. I hope you will all enjoy the session, and we look forward to your questions or comments in this session. Thank you.
Hello everyone, thank you for joining me in this Community Connect session. I'm Ferdiana Yunita, would like to share about the Pentahelix TB Control Multisector Partnership Forum and its action plan called Proteksi. Indonesia has established TB Control Multisector Partnership Forum as mandated by the Presidential Decree and also the Coordinating Ministry of Human Development and Cultural Affairs Decree in 2021 to engage the community, stakeholder, and multi-sector in TB control program. It consists of 5 sectors, that's why we call it Pentahelix. The first is the government, and the other is the big one is the non-government sector. The government consists of 7 ministries led by the Coordinating Ministry of Human Development and Cultural Affairs, who helps Ministry of Health as the leading of the accelerating TB elimination team in Indonesia. And the big part is the community. We have a lot of civil society organization involving in this forum, from the professional organization, and not only from the health sector, but also the architects, the pharmacists, and also the TB survivor organization, the faith-based organization. This is the big faith-based organization in Indonesia, and also the philanthropists. The other 3 sectors is the private business sectors, the media. It's very important to inform, acknowledge the community about the TB and also the academician and researcher. As we all agree that TB is everybody business and not only the health sector business. We all agree upon our work plan. We call it protection. Protection in English, meaning that we shall provide protection for people who fall ill with TB from diagnosis until the treatment, and also addressing the social determinant of tuberculosis. We developed this action plan based on multi-sector accountability framework by WHO. The first is the commitment, the political commitment from the central, local, and the district government. We have goals to increase the role of the community and also multi-sector in accelerating TB elimination to ensure it will take place in 2030. Our four main activities are focusing on advocacy, promoting preventive, and also providing complementary during treatment and rehabilitation as well, based on partnership. The advocacy is to ensure the government and multi-sector commitment, while the community empowerment to encourage the TB case finding, case holding, TB preventive treatment, contact investigation, and also the most important thing is to address TB social determinant, like providing housing, shelter house, nutrition enabler, psychosocial support, and economic empowerment through vocational training and providing startup capital loan support. Those we also raising awareness of community through behavior change campaign, and all for those four activities are being monitored and report through operational research and implementation research by the academician and also the researcher and also the implementing partners in provincial health district until the provincial health office and district health office. And those bottleneck challenges are identified to provide a solution for better future implementation guidance. That's all from me. Let's have our further discussion. Thank you very much for your kind attention. See you next time.
Nilhani as a disease control coordinator of the Coordinating Ministry for Human Development and Cultural Affairs of the Republic of Indonesia. Thank you to the Union for the opportunity given to deliver a presentation in this nice occasion. I will talk about the role of central and local government, community, and stakeholders on TB accelerating program in Indonesia based on presidential decree. So let me start my presentation. Regulation of TB control multi-sector engagement in central and local government have been mandated by Presidential Decree number 67 in 2021, verse 5 and 7. At national level, TB control accelerating team, we call TP2TB, has been mandated, verse 25. Presidential Decree consists of 19 ministries and Ministry of Health as the chairman. To optimize community and multi-sector engagement in TB program, thus TB Control Multi-Sector Partnership Forum, we call WKPTB, has been established by Coordinating Ministry for Human Development and Cultural Affairs Decree number 40 in 2021. As been as mandate for 17 Presidential Decree, Health Quality and Population Development Deputy of Coordinating Ministry for Human Development and Cultural Affairs is the chairman, and Disease Prevention and Control, the General Director of the Ministry of Health is the vice managers. While in the district, the combination of TP2TB and WKPTB is a joint team called TB Control Multi-Sector. TB is everybody business. Multi-sector engagement in TB program shall be implemented nationwide, and all stakeholders are welcome, including individuals, government, educational institution, and as onlys. The role of government and community shall be synergized, synchronized, and collaborated to ensure the roles that have been mandated by Presidential Decree be implemented and are in place. Those interacting roles are the central government role, set the policy, the local government role, set TB indicators in local government strategic plan, established by governors, region, mayors to encourage person with TB complete the treatment. At central government role, integrate activities and provide resources, while the local government role shall be coordinate DB control in the region and provide funding from multiple sources and provide and improve human resources. The local government encourage active case finding and involving community, ensure recording, reporting, and provide TPT. The government, both central and local, mitigate the psychosocial and economic impact of the person with TB and their families, and will assist by community. The main roles of community is promotive, preventive, rehabilitative, and complementary curative, including preventing stigma and discrimination. All have been integrated as roles of TB control multi-sector partnership forum. Role of WKPTB to achievement TB elimination on 2030 are encourage the involvement of communities, stakeholders, and other multi-sectors in TB program, and also coordinate, be a liaison between community and government routine coordination forum at least once in a year, and provide recommendation to TB accelerating team. This is all for me. Thank you so much for attention.
Hi everyone, my name is Heni Ahmad. I'm the National Program Director of PRTB Consortium Penabu SCPI and the Chair of Community Empowerment Unit in the Pentahelic TB Control Multisector Partnership Forum. I would like to present the community contribution on case finding and case holding for TB elimination in Indonesia. So the role of this Community Empowerment Unit is to encourage the involvement of communities, stakeholders, and other multi-sectors in planning, funding, and implementation, as well as monitoring and evaluation in order to increase the required resources for TB elimination at national and district level in Indonesia. The member of this Community Empowerment Unit in Pentahelic TB Control Multi-Sector Partnership Forum is around 35 NGOs focused on TB program. And the objective of this unit is to increase partners' capacity in encouraging community-based surveillance, such as case finding and case report, contact investigation, and assistance in providing TB prevention therapy and treatment assistance. Also to increase partner capacity in promoting health facilities and institution-based surveillance, and also to increase capacity of partners in providing complementary support in the form of shelters, healthy homes, provision of additional food, and transportation. We work in 30 provinces in Indonesia in 190 districts through partners and branch organization of these unit members. Our front line is cadre, and the total number of active cadres is around 14,500 people who are actively screening and finding new cases of TB. And also at field level, they are supported by case managers and patient supporters, especially for DRTB patient. The Community Empowerment Unit also strengthen partners' capacity on program implementation, management, and reporting, recording, and financial side. And for complementary support, for example, one of our member is Architect Association. They provide support for housing for people with TB. And one member is MPKU Muhammadiyah. They provide ambulance and also Dompet Duafa. They support nutrition and generating income activity for DRTB patient. So we hope that this presentation could give you information about our unit activity. Thank you.
Hello, I'm Ruli Octavian. I would like to share Empowering TB Control Multisector Partnership Forum in Indonesia. The role of architects in combating TB through healthy housing and shelter for people with TB. I think everybody agree regarding sustainable developments. I would like to highlight the message from President Republic of Indonesia regarding TB reduction in 2030. Medication is a main focus, but prevention is important, and a healthy house is a key. And then a message from Director General of WHO regarding unsafe housing. The House of Hope is the first program that we already start because mostly people with TB lives in slums area. Unhealthy houses are tiny house with a land only 12 until 20 meters squares. We try to develop become 36 until 46 meters squares. The concept is a multi-split level inside. We try to adapt a good air, ventilation, and sunlight apertures. The second program is a shelter house. The people with TB isolated for 14 days during the first medication period. And in 2021, the shelter house awarded by Indonesian Institute of Architects the best 20 design in Indonesia. The key of a program is collaborations because information on healthy house is coming from another community, and we try to survey investigation together, and we collaborated with the coordination local government as well, and trying to find fundraisings. We open donations in social media as well, and after that, after that, we also coordination with the architect network to design process and start to constructions. Hopefully in 2023, target implementation will be provided in 7 provinces with 42 projects. I think this program cannot be separated from the synergy of various multidisciplinary parties to realizing TB elimination. Thank you.
Greetings to you all. My name is Henry. I'm from the Stop TB Partnership Indonesia. Our organization serves as a voice in a community awareness group, together with various organizations and private sector convened within the National Pentahelix TB Control Multisector Partnership Forum. TB is the leading cause of death in Indonesia in the past 3 decades. Tackling this disease requires intervention at various levels. One of those efforts need to focus in improving TB awareness in community, and in Indonesia, we need to do it massively. Most organizations have focused intensively in interpersonal and in-person communication for health promotion efforts to end TB. However, this became challenging when the COVID-19 pandemic hits in 2020. At the end of 2021, STPI, supported by Stop TB Partnership, initiated the first digital communication campaign on TB. It is meant to be simple, actionable, because after the pandemic, information are more difficult to digest due to ambitious, confused, unstable, and unpredictable state of mind. Our campaign strategy aimed to improve TB awareness among people with persistent cough. The campaign targets between age 15 to 39 years old in the 2 provinces with high TB burden. In our pre-campaign research, we found that 11% out of 500 survey respondents acknowledged persistent cough for 14 days and over the TB symptoms. Therefore, our key message explicitly calls for the target audience to get their cough checked to a doctor if the symptoms persist for 14 days or more. Our digital campaign, 14 and 1 check or 14-1 check, also supports the fine action within the NTP TOS TBC strategy. The campaign was prepared for about 3 months with intensive market research using FGD, in-depth interview and survey in 500 respondents within the target groups. We employed 3 main communication approaches through mass media, including large network of news outlets to display articles and advertise informative banners, ramp up content in social media, and collaborate with 13 key opinion leaders and influencers. Currently, in the post-campaign, will be wrap up campaign implementation at the end of August. Conducted online assessment in September and doing our analysis this month. We reached more than 9 million accounts from our target 3 million. Our social media followers increased with 4,000 organic followers. Furthermore, preliminary result from the online assessment shows that the number of respondents who acknowledge more than 14 days are persist cough has TB increased by 21%. This is the first campaign that has established for some quantitative evidence of improvement during a campaign period in Indonesia. There are more room for improvement in the future on how we can measure this better. Moving forward to 2023, national TB stakeholders who are active in building TB awareness hope to establish one mass campaign. We hope to optimize best practice and lesson learned from each other to create a more cohesive national campaign involving multi-stakeholders and minimize noise of information for the public. Thank you for your attention. Looking forward to your talks and input in the comment. Thank you.
Ladies and gentlemen, I'm Yeni Purnamasari, General Manager Health Division of Dompet Duafa. I want presentation about community empowerment in psychosocial support and the economical empowerment of people with TB and their family. One of the area of the TB Control Multisector Partnership Forum is community empowerment in psychosocial support and the economical empowerment of people with TB and their family. Dompet Duafa is Islamic philanthropic organization engaged in tuberculosis program focused on community TB empowerment, education, and complementary support, such as access to transportation, nutrition support, shelter house, and economical empowerment with the Association of TB Survivor Group and other partners. This is our program and work plan for psychological support. The condition of people with TB, there are several factors that affect the quality of life of people with TB, including social support, treatment process, psychological factor, demographic, education, and counseling program. People with TB have a poor quality of life with a high risk of developing depression. Diagnosis TB is one of the stressor-causing psychological disorder, especially depression. Negative stigma in society is still high. Side effect of the drug and the duration of treatment trigger the occurrence of depression, anxiety, and stress. There is no mental health screening services, and there are still limited professional psychologists. Descriptive research result of depression rates in 224 TB multi-drug resistant in the West Java region showed 12 people in severe depression who need professional feedback and referral services. Our program aims to provide psychological support both in the community through mental health hotline and by health worker in healthcare facility. This is the hotline number that can access people with TB in the community. The program includes professional feedback and referral services with the professional psychological organization in 14 district priority area in Indonesia. This is a framework program and project of economic empowerment. Again, the background of the present of catastrophic condition impact of people with TB, who TB is one of the cause of poverty in Indonesia. The many research saw data on many catastrophic impact, especially in TB multi-drug resistant. So the output of our program is increases compliant TB and their family have an income and be economically independent. The program starts with the input baseline data report of people with TB, needs assessment profiling people with TB, and stabilizing target group and partnership cooperation. The process starts with the identification of the type of economic empowerment, training and people development capacity, provision of business capital stimulant, coaching and mentoring, opening a market network, and monitoring evaluation. One of the projects is the cooperation between Dompet Duafa and TB Indonesia to training salt egg making with 45 people with TB as beneficiaries in 3 districts in Indonesia. Thank you.
Hi everyone. As we know, TB is a complex disease. It needs a multiple partnership to solve TB problem in tuberculosis. I'm Ivan on behalf of Indonesian TB Research Network that we call JetSet TB Indonesia. I would like to share you briefly about the role of the JetSet TB Indonesia in supporting tuberculosis multisectoral partnership in Indonesia. Let me start from introduction of JetSet TB Indonesia. JetSet TB Indonesia is an independent national research forum established in 2017. We focus on the controlling tuberculosis and also supporting TB programs in Indonesia. The mission are to build actual and factual TB research data, capacity of TB researcher, effective communication among the researcher and the policymaker, partnership strategy with the National Tuberculosis Program. The member does not only consist of a TB researcher, but also healthcare provider, TB programmers, so that it has been a linking forum between academician, TB practitioner, and TB programmers. What are the activity of JetSet TB Indonesia? We have a weekly meeting of the executive board to discuss program and also research opportunity. We also have a capacity building and membership engagement in form of training and workshop. We also develop TB policy brief considering study from Indonesian researchers. We also have the annual scientific meeting that we call INA Time to disseminate TB research finding among the Indonesian researchers. As one of the fundamental milestones, we have developed a TB research agenda 2020 until 2024 as the guidance for TB research and program development in TB multi-sector partnership. So how the National TB Research Agenda developed. First, we started with the literature review to map existing research and publication related to TB in Indonesia. Then we continue with the open survey that include all TB stakeholders, including TB patients, to identify real problem and potential research. And then two-stage Delphi survey were conducted, inviting TB experts to identify what's the research priority based on the literature review and the open survey. We finally defined 10 research priorities agenda. And as you can see on the slide, here's the top 10 TB research priority in Indonesia that can be guidance for developing multi-sector partnership program in Indonesia. So what the future activity of JZTB in supporting multi-sector partnership program? We first partnership strategy will be continuously developed by the research and development. And as one example, currently we attempt to engage a pharmacy as the potential facility for TB patient detection and treatment supporter for patients with TB. As you can see on the slide, here's one of the publications that can be read in the BMJ Open Journal. Second, we are developing an updated TB policy brief as the tool to advocate the need of TB prevention and care, including also multi-sector partnership program in Indonesia. Data were extracted from the last our scientific meeting in a time 2022 held in a month ago in Bali, Indonesia. Third, we will develop a monitoring and evaluation tool for multi-sector partnership program led by TB Control Multi-Sector Partnership Forum. That's all my presentation. We will be happy to have your question and comment. Thank you for your kind attention. Have a great day. Bye.